What is incontinence? Many women wonder if they're struggling with true incontinence issues or if their problem is just a little something that should be able to clear up on its own, and if they need to talk to a professional about it or seek some kind of help, and who do they ask for help? So I'm Dr. Amy with Physical Therapy for Everybody, and I love helping women live an active, healthy, and confident lifestyle, pain-free, without drugs, and without having to have surgery, particularly when we're talking about incontinence, because so many women are really scared to get the surgery, the slings or the meshes and the things like that. You know, you don't want to be putting extra parts down here, right? And I get that. So what are your options if you're struggling with incontinence? First, let's talk about what the different types of incontinence are. So the most common ones that we see are stress incontinence and urge incontinence. So urge incontinence is, oh, I need to go to the bathroom and I can't get there fast enough, or I can't get my pants down fast enough and I end up not making it. That can be caused by a number of issues, but often it's the fact that you do not have either the signaling going up to your brain telling you when you need to go, or you have difficulty making it there in an efficient manner. Really, ideally, what we want is the signals are going up to the brain in an efficient manner so you have enough time, right? You shouldn't be like, oh, I have to go to the bathroom and I have about 30 seconds to get there. You should have more latitude in life than that. Now, if you have stress incontinence, that's more when you're having the laughing, coughing, sneezing, you do a little bit of leaking. If you try to jump on the trampoline, you're gonna have to pad up. Going for a run, you're gonna have to pad up before you run. All of those things. That would be considered as stress incontinence. Now, you can have a little bit of both, and that's called a mixed incontinence. So you have a little bit of aspects of both. Most people start with one, and then the other one may be added in. What I can tell you is this definitely is a clear sign from your body that there's something going on with your pelvic floor. More than likely, your pelvic floor muscles or your deep abdominal muscles, so the muscles like way down there, are probably tight. The question is, why did they get tight in the first place? Is it because your hamstrings are tight? Is it because your glutes are weak? Is it because you have a SI joint malalignment? Is it because of your low back and everything's not functioning correctly? All of these questions need to be answered so that you can properly address this issue. Because you can have a surgery that will quote unquote fix the problem, but if you haven't dealt with the root issue, your problem will come back over time. It's really important to work with a specialist who is able to find the true root cause of what started this in the first place and unwind the tissues so that they're able to heal. Every tissue in your body is designed to be able to heal itself as long as it has the proper stimulus that it needs for repair. Depending on the tissue, that's different. But with muscles, which is what we're talking about with the pelvic floor, that's a contraction and a relaxation. What I commonly see in the clinic is that the pelvic floor muscles are not able to relax. So we're walking around with these really, really tight pelvic floor muscles all the time. And then you do something like realize you need to go to the bathroom, or you cough and your body's like, I can't do it. I got nothing left. And you're stuck running to the bathroom or leaking when you cough. Now, the other thing that's really important to note here that many people don't know is that your pelvic floor works in opposition to your diaphragm. So your diaphragm is that big breathing muscle, right? That's at the base of your rib cage, and it is super important to make sure that you're doing your diaphragmatic breathing. However, if that big muscle gets tight, the pelvic floor will also get tight because it doesn't know what to do. They're supposed to work in opposition, and it's freaking out because the pelvic floor knows I can't just totally go loose, right? Can you imagine? That would be horrible. So it can't totally go loose, so what does it do? It's gonna tighten up. It creates a lot of pressure in that abdominal cavity, which can have other problems other than the ones we're talking about today. But it's important to have your diaphragm checked too, because if your diaphragm is not moving correctly, that is also going to cause problems with your pelvic floor. That's why it's important to work with a specialist who's able to look at your body, understand what's going on, unwind all of these issues to figure out what the root cause is, and help you create a plan that will get you back to doing all the things you love doing without pain, without incontinence, without having to worry about wearing a pad, without having to limit what you do because you're just concerned or you're fearful or you don't know what will happen. If you have more questions on this, I ask you to drop a comment below because we always love making videos to help answer your comments. If you like this video, click subscribe so you know when our videos drop. Have a great day, everyone.